Hello and welcome from Geneva, Switzerland. This is your weekly COVID Africa media briefing. I'm Peter Van Ham and I'm joined today, as always, by Dr. Matshidiso Moeti in Congo, Brazzaville. She's the regional director, of course, of the WHO. Also joining from Brazzaville, from his home, I believe, is Dr. Michel Yao from the WHO. And we're happy to welcome two special guests today. We'll have Chris Nikoi coming on. He is the regional director of the World Food Programme in Africa. He's based in Dakar, Senegal. And then we're welcoming also Dr. Gerardine Mukeshimana, who is the Minister of Agriculture in Rwanda. So without further ado, I'd like to get into it. As always, we try to get to as many questions that you have as possible. But before we do, I'd like to turn to Dr. Moeti in Brazzaville for an introduction. Dr. Moeti, the floor is yours.
Thank you very much. So a very good afternoon to everyone, and thank you for connecting with us. I'm very pleased to be joined by the Honorable Minister of Agriculture and Animal Resources in Rwanda. Thank you, Minister, for making the time to join us. And my colleague, Mr. Chris Nikoi from the World Food Programme, to discuss efforts to assure food security in Africa in the context of the COVID-19 pandemic. This is an urgent issue, as more than 200 million people are undernourished in the WHO African region, and the pandemic is making the hunger situation worse. Undernourished people have weaker immune systems and may be at greater risk of severe illness if infected. On the other side, we also know that obesity and diabetes are linked to a higher risk of hospitalization and death related to COVID-19. As far as the situation is concerned, there are now more than 72,000 confirmed cases on the African continent, and almost 2,500 people have sadly lost their lives. As of this week, the pandemic has reached all 47 countries in WHO's Africa region, with a case being confirmed in Lesotho yesterday. On average, over the past 2 weeks, 1,500 new cases have been reported every day in the WHO Africa region. As countries relax social measures, and this needs to be done step by step, informed by data, with scaled up public health capacities, including testing, communities must be informed and enabled to implement preventive measures like physical distancing, hand hygiene, covering the mouth and nose when coughing, and disinfecting surfaces. Also, covering the mouth and nose with a mask when people are out in public. Continuity of essential services is also incredibly important. This week, a new modeling study by WHO and UNAIDS indicated that there could be 500,000 extra deaths from AIDS-related illness in sub-Saharan Africa if antiretroviral therapy is disrupted for 6 months. The World Health Statistics published by WHO yesterday reported that sub-Saharan Africa accounts for 66% of the world's maternal deaths, and only 1 in 2 women have their family planning needs met. So every woman should have access to quality healthcare, and this reaffirms the importance of continuing providing essential services even as we respond to the COVID-19 pandemic. We also need to pay close attention to transmission in settings where preventive measures are very challenging, like prisons and camps for refugees and displaced people. From the first signal that something is wrong, any person who may be infected should be isolated, tested, and provided with care. In closing, I'd also like to encourage everyone to tune in to the Africa at Home Together Against Coronavirus concert on Canal Plus Afrique this Saturday, the 16th May at 8:30 p.m. GMT. I thank you very much for having joined us.
Thank you, Dr. Moeti, and indeed, we're looking forward to that special concert on Saturday on Canal Plus. I'd like to invite also Dr. Chris Nikoi to make your introductory statement, if you will, with us today. And
Hello, can you hear me?
We absolutely hear you. Go ahead, Chris.
Everyone, ladies and gentlemen, before the COVID-19 pandemic, hunger was already a real concern for many people in many parts of the African continent. In fact, in West and Central Africa alone, pre-COVID-19, food security assessments had already estimated that 21 million people will through August and in some cases to September. This is a 70% increase from last year.
Chris, could I just ask if you could repeat those numbers, because you broke up for a moment with us just now. Okay.
I was saying that food security assessment estimates that
it's
themselves and their families during this year's lean season. That is June to August 2020. And this represents a 70% increase from last year, the same time. And why is that? This is due to climate shocks, people having their livelihoods disrupted, and being uprooted from their homes as a result.
I think you're trying to say that it's a result of the COVID-19 crisis. But again, you're breaking up, Chris. So we're just going to try to restore your connection, and I'd like to see if we can briefly go back to the minister, if she's with us already, Dr. Gerardine Mukeshimana. If we don't, then I'd just like to ask perhaps quickly as we restore the connection, and we'll get back to you soon, Chris. But I'd like to see if we can, in the meanwhile, go to a first question. I know that there's many questions of you today, and a first one from Rhoda with the BBC in Kenya. As we get back to our speakers, could you please come in with a first question for Dr. Moeti? Rhoda, go ahead.
Thank you so much. I have two questions for Dr. Moeti. My first question is in regards to what the action that the Burundian government took yesterday, declaring persona non grata the 3 WHO officials. Does the WHO in Brazzaville know why they were expelled? And two, my question is now in Tanzania. What does the WHO make of the Tanzanian government not being able to disclose information about the spread of COVID-19 in the country?
Thank you so much, Rhoda and Dr. Moeti. Please go ahead. Two important questions, it seems, to us.
Yes, yes. Thank you for those questions. So late yesterday afternoon, I was made aware through a note verbal, but about this decision of the government of Burundi, which has asked our WHO representative and 3 other persons, one of whom is a consultant, 2 WHO staff members, to leave the country immediately. What I'd like to say on this matter is that the representative, Dr. Walter Kazadi Molombo, is a long-standing, well-respected staff member of WHO, extremely competent person, who is also a good leader and manager. We are in communication with the government of Burundi to clarify and understand the reasoning behind this decision they have taken. And we are in the meantime then working with the UN system in the country to organize the departure of our staff. I'd also like very much to emphasize that we remain very willing to continue to collaborate with Burundi as a member state of WHO in the African region, and most importantly, to support not only their response to this COVID-19 pandemic and help to minimize illness and death among Burundian people, but also to continue to work with the country on the many other health problems and programs on which we have been collaborating with Burundi. As far as the situation in Tanzania is concerned, again, we continue to encourage the government of Tanzania, like all governments, to provide data, to share data with our experts and teams on the ground, and to give the opportunity then for joint analysis of this data, determination of the trends, where the hotspots are, and advice on the actions that are being taken, how to refine these based on data. This is a principle that we hold with regard to our collaboration with all of our member states, and I can take the opportunity to encourage all countries to share data with WHO, because this is the basis of our being able to advise on measures that they need to be taking.
Well noted, and thank you, Dr. Moeti, for that. We'll get back to Chris Nikoi in just a minute. Chris, I think you have you're again with us. Can we hear the rest of your opening remarks? Please go ahead. Chris, if you can hear us, if you could make the rest of your opening remarks. And while we establish that connection, I'd like to go back to Martin Mariaka. Martin, you also had a question for the WHO. I think you're based in South Sudan with CGTN. Go ahead. And we're just making sure that we can hear you also, but we can see you. Martin, I know that your question is about herbal medicine, Dr. Moeti, the herbal medicine that comes from Madagascar. And the question that Martin had is, why is the WHO discouraging this medicine? As you well know, that Africans depend, according to Martin, on herbal medicine. What is the WHO's stance on that medicine from Madagascar?
Yes, thank you for this question. First of all, I'd like to share information with our colleague that WHO has worked for many years with the traditional medicine sector in the region. In fact, we work very hard to facilitate collaboration and finding a place for African traditional medicine within the public health systems in countries. We have supported most of the countries in the region to develop their national policies and strategies with regard to incorporating traditional medicine into their way of providing healthcare to populations. And we have also worked and supported the, if you like, assessment and trials of some herbal products in a number of countries to treat different conditions under scientific settings, under scientific conditions, to look at the efficacy and the safety of these products. So just to emphasize, we have for decades encouraged very much the incorporation of traditional medicine into the way that governments provide healthcare to their people, because we recognize that this is a recourse, this is a resource for providing healthcare for African people. So what we are encouraging is very much along these lines and in line with these principles, that any medicine that is being used, including this product in Madagascar, we advise be taken through some assessment. How effective is it? Under what sort of conditions? What might be its side effects that may be undesirable? What could be the dosing that needs to be adjusted? So this is what we are encouraging, and we are looking forward very much. We've initiated through our country office a conversation with the government of Madagascar, and are looking to see the conditions under which we could cooperate with them in testing out this product. So to conclude, we are not at all discouraging the use of a product, but we would like that we would like to advise that it be tested out, so that when we celebrate the discovery of this treatment in Africa, it is on the basis of some evidence which can be shared with people in Africa and all over the world.
Absolutely. And I think there's also a next question already while we have some audio from some of our participants. They'll be with us right away, but I think we'll try to go to Giulia Paravicini right now. Giulia, if you can hear us, go ahead with your question.
I can hear you. Can you hear me?
Absolutely. Go ahead.
Okay, so, well, one question has been partly answered, and it was on basically the WHO response to your staff being thrown out of Burundi. I have another question on Burundi, namely, what is the WHO view on Burundi holding large election rallies and elections, whether you see any health risk in it? And then I have a second question, either for Dr. Moeti or for Dr. Yao, on the case of the fish factory in Ghana, where one person infected over 500 workers. Our reporters have been trying to get information about what happened from the Ghana authorities, but hasn't really worked out. So are you involved in that case? Are you tracking it? Do you have any info on it? And last,
we'll address those first two questions first, Julia. And I'd like to go to Dr. Yao, who can perhaps answer that question on the fish factory in Ghana, and then afterwards we'll come back to your question about the Burundi election. So Dr. Yao, go ahead.
Thank you very much. I will say that our team there are working closely with the national authorities to gather more information, but time being, we don't have a detailed investigation on that. But the country office is closely involved, working with the surveillance team to investigate any COVID case, as well as also providing support in the other areas like treatment and also laboratory testing. So maybe soon we will have further information on that.
Thank you. And then we had a second question that came in on elections. It was a specific question about Burundi, but perhaps also more in general, some guidance, Dr. Moeti.
Yes, thank you. I think I'll start with the general guidance as far as what we call mass gatherings are concerned. So having many people gathered together in the same physical space. I think we're all aware now that one of the principal measures that is being promoted is to keep a distance between people. So to minimize the risk of droplets, mainly containing the virus, if the person who is coughing, sneezing, or speaking is letting out these droplets, then be landing onto somebody else and transmitting the virus to them. So the principle is very much on keeping a distance to the extent possible between people, and also encouraging then the use of barriers such as masks, so that these droplets can also not be able to be carried and transmitted between people. Coming now to elections, we have seen this discussion about elections going on, I have to say, not only about Burundi or countries in Africa, but worldwide. We've also seen some countries able to carry out elections with the proper measures of social and physical distancing being put in place, and conclude that this has been safely done. Other countries, of course, where the facilities are available, have been able to carry out electronic voting. This, I think in our context in Africa, might be a challenge. So our advice is that any gathering of people needs to be carried out with the measures being put in place, physical barriers in terms of droplets, physical distancing among the people involved. I imagine if elections are being planned, it will be very important for these measures to be put in place, so that it would require the type of logistics, forward planning, monitoring how people are gathering, distributing largely the masks, I would imagine, free of charge, so that people can get them, people can use them, and very much helping people themselves to know and to understand that even as they gather for this purpose or for any others, it is very important for them to keep that physical distance, and assuring that this event does not then become an occasion for the virus to spread further in the population.
Very well. Thank you so much, Dr. Moeti, for that. And I think that our other speakers are also back now. I'd like to try to go to Dr. Gerardine Mukeshimana in Rwanda. I think you're joining us by audio only. Dr. Mukeshimana, could you please make your opening remarks? And while we wait for you to come back, I'd like to turn perhaps to Leonce. Leonce, you're joining us with a question for the WFP, which I believe is also back now with us. Liance, why don't you go ahead? We're just unmuting you. Liance, yeah, go ahead.
Okay, thank you very much. My question is basically for the regional director for food program, like on the impact that this COVID-19 is having in the region. We have seen in the Central and East African region having many shocks threatening food security from the locusts, desert locusts, floodings, and the COVID-19 effect. Where do you see this wave going, reaching in terms of the numbers of people who might be affected by all these shocks? Thank you.
You're welcome. Thank you for that question. And Chris, Nikoi, I think you're back with us. Could you please answer that question? And we're just unmuting you. Go ahead.
Yeah, thank you for the question. Again, my apologies for the challenges I had with technology this morning. As the gentleman said, and I will speak to this more from the West and Central African perspective. Okay, he's definitely right. Even before COVID, we had a number of shocks which were affecting people. Of course, one is climate change, which is affecting large swaths of Africa. And in fact, I'll say the Sahel region is sort of the epicenter of this effect. In addition to that, we're having shocks in several parts of the African continent. And again, West Africa or West and Central Africa stands out in terms of conflicts, which have led to large numbers of people displaced and in camps, either as refugees or displaced within their countries. And this affects people's livelihood. So when people are now removed from the land, they cannot farm, they cannot produce, and they are living in camps. Also, this affects transportation and trade flows within countries, where if you look at what we call the Liptako-Goma region of Mali, Niger, Burkina Faso, trade across these countries, which has historically been there, all disrupted. And even within countries, because of the conflict and insecurity, food flows were already not optimal because of conflict across West Africa. Cameroon, the Anglophone crisis, etc., and then Northeast Nigeria. So we already, before COVID, had a situation in which livelihoods, economic activities were already disrupted. And now with COVID, governments are having to put in place certain measures, okay, lockdowns, restrict movements, etc., which are making an already bad situation in some areas, in some contexts, worse. And West and Central Africa, for example, stands out in this context. We have estimated, for example, that by the end of this year, if the right measures are not put in place and the COVID pandemic continues to evolve, we could see in just West and Central Africa alone, something like 22 million people added on to the 21 million who are already going to be really struggling to feed themselves and their families. In fact, all studies that I have read, our own data, and I'd like to also quote from WHO's own work that they did, I think it's called the PERC. When I read the report, one of the things that comes out from talking to something like 20,000 people across 28 African cities is this big concern about food. Because in Africa, as we know, in many of our major urban metropolises, there are large numbers of people who literally live from hand to mouth. They have to engage in some sort of livelihood on a daily basis, trade, go out and repair something, or bring produce into market and sell in order to feed themselves and their families just for the next day or the next 2 days. And if they are not able to do this, they will have no means to feed those children. In addition to that, let me just mention quickly, last point, schools, with schools closed right across the continent. In fact, about 65 million children who are benefiting from some form of a nutritious meal at school are no longer getting it. And we are having to think how, with governments, how to replace this, especially for the areas that were already depressed and where mothers were already struggling to feed their families. I heard from a lady in Gambia, for example, who was saying how the fact that her children were no longer in school meant she had more mouths to feed, and lamenting the fact that at least when they were in school, they got one meal a day. That was a big cushion for her, and lamenting the fact that now she has to provide for all these children. And so these are some of the impacts that the COVID is adding to a situation which was already not good. Thank you.
Thank you for that clarification and your extensive answer. I'd like to go now to Elizabeth Merab with the Nation Media in Kenya. Elizabeth, you have a question for us as well, don't you?
Hi, good afternoon.
Good afternoon.
Thank you for the opportunity. My question to Dr. Moeti is with regards to the easing of lockdowns. While we are seeing countries easing these lockdowns, we are also seeing resurgence. So how does that look for African countries that are now registering high numbers?
Thank you for that question. And Dr. Moeti, go ahead.
Yes, thank you for that question. We are working with countries to very closely, country by country, and sometimes even within the country, different localities, because we know that the impact, or if you like, the situation of the spread of the COVID-19 virus is not the same all over the country, even in countries where there is community spread. It's still very much in the capital city and in a few other places. And therefore, what we are working with countries to do is to look at the data and see what is the trend in this area where they are contemplating lifting the measures, what measures are being lifted first, where the risk of resurgence might be minimal, what can then be done next. So the data is serving to advise on a step-by-step process. So it's not only data in terms of the trends in the cases and the spread of the virus, but also information about, if you like, the strength of the public health measures, the scale of these public health measures. Do we now have a solid platform for identifying cases, testing people, contact tracing, isolating people, and stopping the transmission of the virus? That would then give us a sense of comfort about removing some of the measures while we monitor. We also need to be very closely looking at the capacity to detect cases as they come into the country at frontiers, whether by air or by land. And very importantly also, whether people have understood and are enabled to carry out those personal protective measures that we have discussed many times. So the hand hygiene in the houses, the social distancing, and some of the study that Chris was referring to earlier to look at people's knowledge, perception of own risk, capacity at home to carry out some of these is some of the data that's guiding what is being done. As we've said before, it's a challenge of trying to keep the balance. But what I'd like to emphasize very strongly is that it needs to be progressive, step by step, and very much informed by data, both about the spread of the virus and about the strength of the measures that have been put in place and their capacity then to respond, including if there's an uptick of cases.
Very clear. And of course, you mentioned the critical issue of data. And I think we have an extra question about that from Kwame Bokye. Kwame, you had a question specifically about Ghana, but I think it applies for the entire continent. Go ahead.
Yes. Thank you, everyone. In Ghana, the Director of Public Health on May 5th announced that we had reached our peak in terms of coronavirus cases. And from there on, we've recorded close to 1,000 cases. The notable one being the one person who infected 500 people at a fish factory. I want to ask, looking at the data, has Ghana reached its peak? And then also in regards to the African continent, what are the indicators for reaching your peak with regards to also seeing that on the continent, the number of tests are so very, very low?
Thank you so much for that very important question. Dr. Moeti, can we turn to you again? When do we know whether a country has reached its peak, especially in the context of tests not always being available?
Yes, I think that, as you know, the question of whether a country has reached its peak or not is one of the most widely discussed questions worldwide, I would say, because we need to be looking at different factors. We had in WHO modeled, we're about to publish, in fact, a report on a model that we've looked at, we've developed, where we predict that putting together certain factors which would drive the spread of the disease, so population mobility, other social conditions, what might be the stage at which there is peaking of the pandemic. And we had estimated that if there is widespread community spread of the virus within 4 to 5 weeks, it will have reached its peak. And then after that, then it might start to go down, even if it might be from a very high levels. We were estimating almost 26% of the population could be infected in Africa if effective prevention measures were not put in place. So I think it's a matter of looking at the data of a country, seeing, because we know that countries did put in place these prevention measures, starting with surveillance, contact tracing, isolation, and then the physical distancing measures. So what we are predicting now is that we might reach a peak at a slower pace, but at a lower level of cases in countries. And we would need to look with the Ghanaian authorities at their data and see the conditions, the trends, the basis on which they are saying that they have tested, they have peaked. What I do know is that Ghana is one of the countries that have very significantly expanded testing. So they have gone out there looking for cases. Some of the increase in numbers that we are seeing in Ghana may be related to the fact that, in fact, the case definition has changed slightly. In the beginning, they were probably testing people who presented ill at a health facility, meaning behind that there might be other people who are at the early phases or and who are still asymptomatic. But we will look with the Ghanaian government. We know that they put in place very strong measures for prevention, and they're also testing very aggressively, which we think is a good combination.
Absolutely. Thank you so much.
I'll leave Michel to answer perhaps the question about the person and who infected 500 others. I think that question was asked before.
Yeah, Dr. Yao, very quickly, perhaps coming back to that point.
Yeah, I was mentioning that is a case that is under investigation, that further information will be made available as soon as possible. And if we look at Ghana, Ghana trend in the last 4 days, there is indeed some decrease, but we need to be careful, as we mentioned, with the confinement and also the huge number of people that could still be exposed. The resurgence is possible. So while noticing some decrease with a wild testing, as mentioned by Dr. Moeti, we need also to look at any decrease with a lot of caution. Over.
Thank you, Dr. Yao. And I want to turn now to Luke Anami. Luke, if you can hear us, I think you can. So go ahead and ask us your question.
Yeah, my question is about the truck drivers. We have seen cases in Kenya where there are very many measures that have been put in place. So these measures have actually led to a lot of stigmatization. The stigma attached to the truck drivers, and in the process, we don't have the goods. You are not able to get the goods to the right places. So my question is, what measures how is WFP and WHO going to sort out this crisis in this region?
Thank you so much. And then a crucial question again, of course, about the food supply. Is it possible now that there's some problems with crossing borders? I'll turn perhaps first to the World Food Programme to answer that question, and then we might get a perspective also from the WHO. Chris, if you're with us, could you come in on that question?
Okay, sorry, I think Sorry, I think, okay, my camera is on. I thought it was off. Sorry about that. Okay.
Go ahead.
All right. I think it's a good point that as I was saying earlier, I mean, supply chains and their ability to function properly is critical to what we see on markets in terms of prices, etc. And if you look at West and Central Africa, and again, I'll say for East Africa, where in that I have some experience from many years back, those markets were fairly well integrated, and what we are seeing with the precautionary measures being put in place, we are already seeing screening tests, for example, for even ships arriving in ports like Douala and others are having to wait 14 days before being allowed to berth for them to make sure that nobody on the crew members are not infected. We are also having very long delays at border points. I mean, we are tracking some of the border points, and even though no governments have not actually closed the borders for the movement of goods, the fact is that with some of the measures they've put in place, this is now slowed down. In fact, in some border points, trucks are being delayed anywhere from 7 to 10 days. Okay, and that is really critical, that if these are the trucks that are moving the food and the other products that we use, and it's leading to one increase in prices. We are seeing that, if you look at the border into Central Africa, etc. And of course, some people are also taking advantage of this situation to engage in illicit bribes and things like that before allowing trucks and others to cross. The point here is that is trying to find the balance between making sure that people coming over are not bringing the virus, but at the same time enabling the commerce, which is critical to function properly and as efficiently as possible. In fact, in these situations, that it becomes even more critical to allow trade and commerce to function in the most efficient manner. So what are we doing from a World Food Programme perspective is we are trying to provide policy advice to governments. And I'll give you an example of one of the measures, the events that will be happening. Tomorrow in West Africa, we have a 3-hour consultation with all the member countries in West Africa, with ministries of agriculture, commerce, ECOWAS, the SAILS, which is the interstate body for drought prevention, etc., to discuss some of the, and then we're also having the transport federations and the agricultural, the sort of food producers and food sellers associations, all participating with advisors to presidents and all that in this 3-hour forum tomorrow, to try to discuss the sorts of measures that need to be put in place so that the flow of food and goods is not overly restricted. So to give an example of what we are doing is that we are supporting this consultation, which is meant to provide policy advice and measures that ECOWAS countries across the board will be encouraged to adopt so that food flows much more smoothly. And I hope that in Eastern Africa, they will also be looking at similar measures. Thank you.
Thank you so much. And of course, we hope the same. We want to go now, on veut aller à une question de Falila Gebadamassi. Falila, une question en français. Allez-y.
Bonjour à tous. La question que je voulais vous poser est à propos du schéma de la pandémie en Afrique aujourd'hui, y compris l'Afrique du Nord, qui n'est pas, certains pays de l'Afrique du Nord ne sont pas dans la zone, dans la région OMS de l'Afrique. C'est quelle est la trajectoire, quelle est l'évolution de la pandémie aujourd'hui, à part les chiffres que vous avez donnés en introduction de la pandémie en Afrique, et quels sont les constats que vous avez faits, ces caractéristiques, en fait, après plusieurs semaines d'observation maintenant? Quel est le schéma de l'évolution de la pandémie et quelles en sont les grandes lignes? Merci.
Merci Falila, et c'est bien de vous voir parce que je pense que vous avez posé déjà des questions dans les semaines antécédentes Donc, c'est bien finalement de vous voir et de vous entendre. Dr Yao, pour cette question, pouvez-vous répondre, s'il vous plaît?
Merci beaucoup. De façon générale, en Afrique, que ce soit les pays de l'Afrique du Nord ou de l'Afrique subsaharienne, on observe toujours une augmentation de cas, mais particulièrement dans la région subsaharienne, on a constaté que si la progression continue, on a le nombre de cas qui pourrait être multiplié par 2 chaque 8 jours. Et donc, c'est une tendance à la hausse qu'il faut observer. Pour toute l'Afrique, plus de 70 000 cas et plus de 2400 décès, ce qui fait à peu près 3,4% de la létalité. L'autre observation faite, c'est que l'épidémie se trouve en ce moment, le plus grand nombre de cas se trouve dans les capitales. Et les régions beaucoup plus éloignées sont moins touchées dans la plupart des pays. Et donc là, il y a possibilité d'agir pour protéger l'arrière-pays et surtout s'assurer qu'on utilise ce momentum-là pour mieux préparer l'arrière-pays pour pouvoir répondre. L'autre aspect aussi est que plus de la moitié des pays dans la région subsaharienne de l'Afrique ont une transmission communautaire et donc avancent probablement vers des pics. Et donc, il faut absolument renforcer les mesures de prise en charge, notamment de détection, de suivi des contacts, de tests, mais aussi de prise en charge. Et puis, l'autre aspect, je pense qu'il viendrait certainement des questions, c'est que le profil des malades est qu'on a une bonne partie des malades, des patients entre 20 et 50 ans, et il y a aussi une proportion au-delà de 61 ans, mais qui est dans une proportion moindre comparée à ce qu'on a observé en Asie ou en Europe. Donc, c'est une tendance globale à la hausse avec des grandes villes touchées et l'arrière-pays qui reste à être protégé, mais aussi la nécessité de décentraliser très rapidement pour qu'il y ait une capacité homogène à travers tous les pays pour répondre à cette épidémie qui pourrait être longue tout en assurant une continuité des services. Merci.
Merci beaucoup pour cette réponse, Dr. Yao. And we turn now to Tim Cohen from the Business Maverick in South Africa. Tim, please go ahead.
Hello, thanks very much. Dr. Moeti, I just wanted to ask about this open letter that has been published today. It was signed by 140 people, I think it's 60 or so, 50 former world leaders. It's in the name of the South African president, Cyril Ramaphosa. It's a sort of a little bit hopeful, I think. I mean, they're talking about a vaccine. There seems to be lots of concern, of course, that the vaccine will be expensive and won't be available to everybody, particularly to African countries. In the letter, he actually addresses the WHO specifically and says that the WHO should press for mandatory sharing of all COVID-19 related technology, as well as the scale up of manufacturing so a vaccine could be made available worldwide. I just wanted your response to that. Do you think the WHO should press for mandatory sharing of COVID-19 technology? Thanks very much.
Thank you, Tim. Dr. Moeti, we listen to your response.
Yes, thank you very much. So I'm not aware of the letter, if it was published today. Sorry, I was handling a couple of other emergencies. But I mean, certainly WHO is part of a coalition that is working very much towards equity in access to any vaccine that is being developed. We've seen in the past few weeks some events organized by WHO and the consortium, including groups like CEPI, which is already an alliance of countries and organizations that have worked together to help to to manage the process of the research and finding of the vaccines used in the Ebola outbreak. And very much the same principles are being adopted in working together to ensure that the private partners who are going to be investing in this, the governments who are going to be benefiting, the multilateral agencies through whom funding and some of the technical capacity is being mobilized, work together to ensure and get agreement on equitable access to the vaccine. I think certainly there is going to be need for an investment of resources for those private sector companies that are developing some technologies to feel that their investment is going to be rewarded or sufficiently rewarded in this consortium and global partnership. So WHO is very much at the center of and working with these partners. We have all along encouraged very much the TRIPS, which was an agreement made about sharing information, intellectual property, and technology transfer, so that this can enable production of key tools for public health in a way that facilitates access to those who are not able to pay and compete on the open market. So just to answer you, I would say WHO is very much part of a movement at the global level to encourage this. And we are going to continue to work with partners towards the objective of equitable access, and particularly access for African people.
Thank you so much, Dr. Moeti. And I think we have another question also from Adam Vaughan. Adam, go ahead.
Hi, a question for Dr. Moeti and the other panelists. Just wanted on the food security side of things, what are your best and worst case scenarios for undernourishment as a result of the pandemic? I just wanted to get an idea of what the range is. And also, sort of related question, I wondered, is the big issue this food, in terms of a food crisis, it seems quite different to 2007-08 because it's, demand is down and food stocks, I understand, in quite a lot of places are relatively full. I wondered if it's more an issue for further down the road in terms of the food security issues where, people simply can't afford to buy food because of the economic downturns that are coming.
Thank you, Adam. And perhaps very quickly, if you could share the media that you're representing.
Sorry, it's Adam Vaughan from New Scientist magazine in the UK.
Thank you. And if I we'll get straight away to Chris Nikoi. I wanted to see if Tommy Moyan, I see him also online with another question. If we can get that question also in. Tommy, go ahead and I will answer both questions.
All right, thank you for the time. I just want Dr. Moeti to be more specific. Tommy Moyan from Compatriot magazine in South Africa, we're Pan-African magazine. I'd want her to be more specific on the Madagascar cure for COVID-19. What's the WHO doing? Have they taken this cure? Have they started looking at it more closely? And have they taken it to their labs to see if this cure is going to work? And if it's going to work, they should issue a public statement to the whole African countries to start using the cure. And how soon can we get a definite word from WHO Africa on the Madagascar cure? That is my question. Thank you.
I think that's heard loud and clear. And just to also emphasize that we've gotten a lot of questions about this Madagascar herbal medicine. So we know we've already addressed it twice, Dr. Moeti, in this call, but that question to be more specific, could you answer that for us one more time? And then we'll go to Chris Nikoi, of course, on the question on food security from Adam. But Dr. Moeti, go ahead first.
Yes, thank you very much for that question. So to be specific, we have been in touch with the government of Madagascar. We have, our representative has, of course, spoken to the Minister of Health. She has had a meeting with the head of state. We have offered to support the design of a study or to look into this product. We are in discussion with them about under what conditions this might happen, as I have said before. And I think this is as far as I can go. We are in contact with, speaking to the government. Our Director General is going to be speaking to the head of state. What we are also helping them to understand is that we would be very happy to work with them. I think it is a matter of working out some details of the conditions under which this might happen for us to reach out, to design how to look at this plan together. Understanding that in Madagascar, they do actually have scientists and researchers who would be very capable of doing this. So we are offering to work together with them so that we can make the kind of pronouncement that you're asking for based on data that will have been gathered about the efficacy of this Madagascar product. I think this is a specific I can.
Dr. Moeti, you don't have yet any data or evidence on the efficacy of this herbal medicine in Madagascar? No. Okay.
No, we do not. No, we do not.
Okay, I think that answers the question. Thank you so much. And then I want to see if we can go back to Chris Nikoi for the question about food security from Adam Vaughan. Chris, can you hear us and can you get to us on that question?
Thank you, Adam, for your question. I think the question, first, let me say, globally, today, the World Food Programme, okay, let me start from there and then we'll move to the broader issue, is providing assistance to something like 130 million people, of which about 30 million of this group are entirely dependent on WFP's assistance. That is where they get their daily food source from. Our estimates show that another 135 million globally could be added on who will be at the risk of not able to feed themselves if something is not done. Now, what are the issues in the food systems which are at risk because of the COVID? First is on the production side, all right? If you have, if you look at Africa, for example, most people who are producing food are smallholder farmers, and they tend to be the aged population because most of the young people move into cities. Now, if this aged population begin to be affected by this pandemic, it will have serious implications for food production going forward. If I look at West and Central Africa, we are now going to enter into the planting season. And just imagine if in most of rural Africa, older people who farm are falling ill. That's one. If you look at it on the broader global scale, what's happening is that basically trade is being disrupted because of uncertainty, which is different, you're right, which is quite different from what happened in the 2008-2009. By the uncertainty, people are trying to hold on to their supplies. Countries are limiting how much can be sold in terms of even health products and health supplies, and the same applies to food. Again, lockdowns in India and Asia, in other countries in Asia are affecting rice importers, etc., because how markets function require all these people to be moving around and being engaged in business. And this is not happening. We are monitoring what is the sort of inventories that countries have either in country or on sea, especially for food products that they import. And again, you will see, for example, let me just give an example. I was having a discussion with the Minister of Agriculture in Liberia, and beyond 4 months or 4.5 months, she didn't have any visibility on what else is coming, given again, because of these uncertainties. So these are the things that can cause the disruptions. And that's why it's important that all measures that are taken by governments allow the supply chains and trades to function normally, because it is the cumulative effect of all this in the chain. And then when you come into the countries, disruptions in flows. And then lastly, let me just point out that we were earlier talking about the people, the daily wage earners, the people who literally live from hand to mouth. If these people, either because of the loss of their livelihoods, and we've seen riots in parts of Lagos and a few other cities around Africa, if this continues and people cannot have their livelihoods, and governments are not able to quickly put in the social protection schemes that will ensure that they have some access to some funds to be able to buy, or they have access to food. It is this compounding effect that is going to create the serious food security problem. So essentially, it is what needs to be done to ensure that food systems, the production, the distribution, its consumption, all the elements function properly. And the last word, if you permit me, is on young children between 6 months and 5 years, malnutrition. And let me just use the figures from just my region. 2018, we had something like 8 million kids under 5 who were malnourished. This year, having nothing to do with COVID, but just all the issues of conflict and other shocks, this figure is expected to rise to 12 million. And this is even before COVID. So again, if food systems are not functioning, if mothers cannot get access to reasonably priced, nutritious food for their children, etc., we are going to have a very serious malnutrition problem across the continent. Thank you.
Thank you, Chris. And I think we can try one last time to go to the minister in Rwanda. Let's see if we can hear you now. Minister, go ahead if you can hear us.
Yeah, hi, how are you everyone? I think I have been following up on the questions, and I think issues that are being addressed there are real life issues, and this COVID-19. I think it's translating into food and nutrition issues, even the whole economy and livelihoods of people. And for us in Rwanda, we are just coming out of a 49-day complete lockdown, which is now relaxed from May 4th. And I think even before, when this pandemic announced itself, it could be anticipated that it may be translated into food security problems given its transmission methods, but also the proposed containment measures. So for us as a country, when we announced the lockdown, the government of Rwanda immediately defined that the food value chains are among the essential activities, the same level as health activities. And we defined the guidelines on how critical agriculture activities, input and output, supply chains, even food markets, how they continue to function while everyone is respecting the health guidelines. And activities that were to be that usually are conducted in a communal setups, such as extension services, rural markets, and all of these things, they were twisted to use IT tools. And in the cases where people could not move, and the agricultural labor becoming bit scarce, the government assisted the farmers by providing a mechanization support so that we make sure that the seasonal activities are not disturbed. And also our government, I heard WFP mentioning how the dairy people depending on dairy wages are being affected. It is true, they are heavily affected by lockdowns. So what we are doing as the government of Rwanda, we have extended food assistance from the National Strategic Reserves, and also purchasing some nutritious foods that are not having immediate markets, such as milk and eggs. And we support those who usually depend on daily wages, or for the children of families coming from the families with limited income. Yeah. But also, as we usually have social protection programs, we made sure that they continue functioning even if people were not working. And we just finished drafting our economic recovery plan, and our government made sure that food self-sufficiency become a very important component. There are issues that are coming out of
Minister,
our reach.
If I can just ask, because we're running out of time, but we do want to make sure that we get one last question also specifically for you. So I apologize to interrupt, but I think we have Christophe Hitayezu on the line, who is in Rwanda and who has a question for you. And I hope we can get to that and then close the meeting. Go ahead, Christophe.
Thank you very much. The horticulture subsector has been highly affected because the produce was used to be exported and also consumed in hospitality facilities. What are the innovative solutions that to maintain sustainable recovery of the subsector? But I had on another question to Dr. Moeti.
Yeah, I'm afraid we won't be able to get to that anymore. So we'll get to the first question, Christophe, because I'm afraid we're running out of time. So, Minister, can you tell us a little bit more about your plans on that front?
Sure, yeah. I mean, horticulture production is one of the affected sector. And what we are doing is making sure that we are linking producers with the consumers, and so many IT-enabled traders have emerged. But for the exports, I think he knows that government made Rwanda weekly Rwanda flight to where we export our products, and it is still functioning. And we added the second flight of Ethiopian Airlines. So for the time being, we see our exports picking up. Thank you.
Thank you so much, Minister, and thank you to all of the other journalists that have dialed in, and of course to our other speakers, Dr. Moeti, Dr. Yao, and Chris Nikoi. That's all from us here in Geneva today. Thank you, and see you next time.